Thank you. Today I'm going to talk about a little bit fun things and hyperlaxity for treating small wrestler. These are disclosures. The sumo is the official national sport of Japan as recognized by the Japanese government. Historical records of sports dating back to 1500 years ago. Professionalized in the 18th century, the sumo continued to thrive in the present days. The average weight of a competitor is around 300 pounds. The sumo ranking chart, the professional ranking chart, we call in Japanese the banzuke, is like the top king is we call it yokozuna, and the second one is ozeki, and then the top four triangle is we call it makunouchi. These guys are very strong, stronger than another martial arts. And then Julio and Makushita, and then another. All small wrestler is about there are 400 people, always competitors. And then light banzuke is a professional rider. It takes about 2 weeks to complete the banzuke. To win, they must either push an opponent outside the circle or knock them down or anywhere. There are 48 main kimarite here. And the small characteristics is BMI, high BMI, about BMI greater than 48.
Also known as visceral fat. It is stored around the torso, on the back and belly, and within the abdomen. But sumo wrestlers are clearly not like other obese people. One key difference is the way fat is distributed within their bodies. Sumo wrestlers develop what is called subcutaneous fat and not visceral fat. Their fat is stored just beneath their skin. It is easily used up by the body in exercise and does not invade and weaken their muscles.
Sumo is actually collision sports. This is I did this match test about 16 years ago. The left wrestler is Asashoryu, or former yokozuna. He was at the time in ozeki, at the second class. And the light small wrestler is yokozuna Takanohara. He was 30 years ago. Asashoryu was 20 years ago. Asashoryu was very young and exciting. But yokozuna was ACL injury. And finally, yokozuna won. And the sumo also, this we call the shiko, is one of the warm-upping exercise. They hyper abduction may cause impingement, and also the hyper mobile, hyper flexibility, collision and hyper mobile. And also they can move quickly. This is a very interesting video. This is Japan-Korea's World Cup games.
So what are we playing for?
Pepsi.
Sure.
listening to the small lessons. My case is 32 years old small wrestlers presented to 80 months history of right hip pain. Body weight is 440 pounds, to 200 kilograms. And BMI 55. He had a limited range of motion of the right hips and painful fiber and failure test. And modified hard hip score 67 and no arthritis hip score 42. And he had joint space narrowing and radical center 26 and theodore distance 15 and femoral flexion turn 133. And down view also showing the big cam and 3D CT scan showing AIIS type 2. It's causing spinal impingement. And MRI showing limited lateral joint space suggesting severe cartilage damage at the time of the surgery, and also reactive femoral neck osteophyte. So T2 mapping showing cartilage damage. So the problem list is he had FAI with osteoarthritis and superobesity and young active and athlete. So and also MRI, we measured the distance from skin to the joint. It was more than 13 centimeters. So preparation of for the table, we tried to use Smith and Nephew table, but the instruction says don't exceed the advanced spine hip position greater than 300 pounds. So that's why I used HANA table. A HANA table saying you can use less than 224 kilograms. And also from skin to the joint is too long, and the arthroscopy is not so enough to access the joint. So I thought let's go back to the basic. So I decided to use cystoscopy longer than arthroscopy. Cystoscopy setting is it has 0 degrees, 30 degrees, 17 degrees, and also length is 30 centimeters. So this movie showing arthroscopic technique, cystoscopic techniques. This is anterolateral border, and looking back from mid-anterior border, and interportal capsular cut. And then we found superior labrum tears, and then decompressed the AIIS, and then put the suture anchor, and then around put the suture around the labrum, and also second one, the third one, I used knotless anchors. And then tying knot through the cannula, and then we confirmed the secure fixation, and also we performed the microfracture and acetabular cartilage damage, and then released the traction, and then we performed the cam osteoplasty. It was very foggy sometimes. And then finally I closed the capsule using ultra tape. And shoelace suture techniques and release. This is a post-operative X-ray exam, X-ray showing improved femoral neck offset at the surgical time at about 200 minutes. No intra-operation complications. And PR scores, and IHOT and no arthritis hip score, modified hip scores improved from preoperatively to 6 months after surgery. The discussions. The hip arthroscopy for treating the patient with superobesity is very difficult. So Prodromo et al. Demonstrated the surgeon have to consider the pressure, ulcer, and infection, and too much subcutaneous fat, and also to cope with this. So we asked the nurse to decompress during the surgery, and also 2 times dose of antimicrobial was used. And there are several studies looking at superobesity for the hip arthroscopy. And Collins reported a series of 21 consecutive obese patients and 18 non-obese patients. There are no significant difference in PR scores, but obese patients are at increased risk of complications. Gupta also et al. In series of 62 consecutive obesity patients, 122 non-obese patients. There are no significant difference of the PR score, but the rate of the conversion THA and division rate are significantly higher in the obese group than non-obese groups. So in conclusion, cystoscopy is useful as a tool for treating giant small wrestlers. The consideration should be allotted toward labrum repairs and capsular repair and FAI correction for treating small wrestler with FAI and instability. Thank you.
Certainly, what a tremendous presentation, what a brave surgeon, what an excellent idea. We move on then, and I'm wondering if you classify sumo wrestling as a contraindication for hip arthroscopy, Jack. Tell us when we shouldn't do hip arthroscopy.